abscess, if there is a now fluid collection as a result of that cellulitis, and it's formed a phlegmon with a drainable abscess. And then all the way to something we don't want to miss, which is the necrotizing soft tissue infections, something like necrotizing fasciitis, Cornea's gangrene, and Ludwig's angina. So, where does ultrasound come in for this? There are a couple of studies, mostly in the United States, about how point-of-care ultrasound has changed the management of soft skin tissue infections, meaning to see if it is cellulitis versus abscess and how that has changed management. You can see when some of these are used that if you can identify the abscess of how large it is, you can either save the patient from having to undergo an incision and drainage to see if you can use a needle aspiration, or if they don't need either of those procedures, and this is something that you can watch and wait. However, this also showed that there is an overuse of ultrasound for patients with lower extremity cellulitis. So in a patient that has just one side of their one extremity that's swollen, especially in the leg, and we think it is clinically cellulitis. In the United States, at least, there is the tendency to overuse ultrasound to rule out DVT. But kind of having to use your clinical judgment for both of these when you use your ultrasound, and then coming up with your differential, and then letting that guide your use of ultrasound and not the other way around. So, let's go over this first. This, luckily, is normal ultrasound of tissue. So up at the top layer, you get your epidermis and your dermis, which as you see, it does not. So our top layer here is fairly thin, the epidermis and the dermis, and you can see in each layer, it's pretty organized. And then underneath you have your subcutaneous fat, and then this bright white line is your fascial plane, and then underneath is the muscle where you start getting these striations. And it does matter in which view, so either longitudinal or sagittal, transverse or sagittal, of how you're going to see those muscle fibers running around. And now what we want to know is what happens when some of this organization breaks down when there is an infection nearby. So, does anybody know what this finding is called on here? Or what might be happening for this ultrasound? So this right here is cellulitis, and it's hard, as kind of what we said earlier, that you kind of want to know what the clinical picture is of this patient. Because we're starting to see, as compared to this earlier one, let's go back. So here we have these nice straight lines, everything is fairly thin and homogeneous and very structured. We're going to be paying attention for this first part on the epidermis and the dermis and the subcutaneous fat. So now let's advance to this next slide. Where we can start to see, as known as cellulitis, that you're getting that localized inflammation, which causes a chain reaction with your cytokines to create some leaky vessels, and you get some extravasation into the local tissue, which causes the fluid buildup. You're seeing that mostly in the subcutaneous fat area. This is something that we call cobblestoning, because it looks like all of those stones next to each other, and you start seeing the individual fat lobules, which shows us that there is surrounding edema. However, if you did this to a patient who has a history of CHF, so heart failure, and they have notable edema in both of their legs, you would see something similar, because you are similarly having that extravasation of fluid in the surrounding tissue. What you're going to notice first in something like cellulitis is you're getting a thickening of the dermal epidermal layer as well, and then you're getting thickening afterwards of the subcutaneous tissue layer. And then depending on the degree of the edema nearby, you will see more of those fat lobules individualized, so you'll see more stones in that cobblestoning appearance. Also, what you want to be looking for is, how does the fascial line look? Is it clear? Can you see everything behind it? Here is bone. So bone is hyperechoic and bright white as the fascial plane. You can tell it's bone because of the shadowing behind it, so it's hypoechoic. some elements of the last, similar to the last image. We again are looking for how thick this dermal epidermal layer is. It looks thicker than that original image. And then here, you are getting some localized edema. We're not quite seeing the cobblestoning as we did before. You can see some of it on this other image over here, but we're looking for an abscess here. So we're looking for fluid collection. We're looking for the hypoechoic amount of fluid in a kind of similar round structure. So these 4 things we're looking for when there is an abscess present is if it's hypoechoic and mostly an ovoid presentation, because as we know, for some abscesses, they can have septations and they can have slight irregularity, but they will still have general ovoid borders. And then that third one is borders, so making sure that you can clearly see where it's demarcating. And then it should have something called fluctuance, meaning when you press on it, if there is pus inside, that's what this image is showing, is that you would get movement of that pus when you are pressing external pressure on it. If it's not moving around, it's likely not an abscess, and this is not something to go forward and incise and drain or try to needle aspirate. So additionally, looking into the central structure here, the hypoechoic region, it can be heterogeneous or homogeneous depending on what is in there and how long it's been in there. You can get some debris collected, as in this image over here, as we can see that it has slightly different texture and movement as compared to the surrounding tissue, but it looks like it's congealed and it's a little thicker for when you go in and if you decide to drain it. And then you want to look at also the surrounding tissue. You'll start to see some hyperechoic shadowing below the area of your abscess, and you'll begin to see the loss of that organized structure surrounding the area, like we talked about before, as signs of inflammation. So usually with this ovoid border. Okay. So this next one, can anyone tell me what this is, what we're looking at on ultrasound? Huh? Ultrasound, yeah, okay, so this is, this is a lymph node instead of an abscess. So we can see that even though it is round, like the last image, and it has that hypoechoic structure inside, it looks like it has pretty good borders, but what makes it a lymph node instead of an abscess is that this is not a septation, is that is the blood supply going to your lymph node. And so in this case, I always say if you're going to think about going in and cutting something, put color flow on it first if you have an ultrasound, just to make sure that you're not going to accidentally cut into a lymph node. Especially thinking about the lymph node chains and where the presentation is on the patient. Neck, axilla, groin, you want to think about something like a lymph node before going in and thinking it is an abscess and accidentally cutting into it. I've seen one of these in a newer presentation of, I think he had non-Hodgkin's lymphoma, and it looked like an abscess. When we put color flow on it, it had color flow on the inside, versus here on your right is an abscess, as we're seeing blood flow seen with the color Doppler on the outsides of the hypoechoic region versus inside. So the blood supply goes in with the lymph node and is on the outside and the surrounding structure for the abscess. Finally, you can get abnormal lymph nodes, as in cancers, malignancy, if they're inflamed. This is a non-Hodgkin's lymphoma lymph node. As you can see, it's enlarged. It has thickened borders, which would make you think that it's an abscess. However, when you throw the color Doppler on it, you can see that there is diffuse blood flow throughout the lymph node. So, versus if you see in the abscess above, you have the complex fluid structure. It has some irregular margins, whereas in the lymph node, these margins are pretty clear around. Additionally, we talked about the shadowing behind it with the hyperechoic borders. So posterior here, we'll go back, you see the hyperechogenicity, so it's brighter behind the abscess. Whereas in the lymph node, as you can see, you're not getting any of that posterior hyper-echogenic shadowing there. So that can also be another clue that you're dealing with a lymph node instead of an abscess. Go back up with me so we can see a little bit more of the bright white posterior to the abscess on the right. And then we'll go here, and even though it may look on the left of the screen that there's a little bit of enhancement, when you fan through it, it goes away and it's not as bright as with an abscess as you would see on a lymph node. And then here, this one was due to a granulomatous disease of a lymph node. Again, there is not a significant amount of hyperechoic shadowing behind it. It has diffuse blood flow within. The margins is very, very nice and circular, even though we can't see that central fatty hilum structure. Oh, bless you. We can tell that this is not something that we would want to cut into. Okay, so this was an ultrasound of a mass that was found on the neck, as you can see from the CT scan up there. And what kind of evidence are we seeing on this ultrasound, even though it's a little grainy, that might lead you to think of this as a lymph node versus an abscess? It has a hilum going in, okay. Here, we think that might be a hilum, okay. What else? This one's tricky.
Behind it, there's no white.
Okay. Okay. Okay, good, okay. So if we were to go maybe in order, we can look at, see, what do the borders look like? When we think back about that lymph node, how were the borders around it? They were pretty round and pretty well encased. What do we think about the borders of this structure here? They're a little fuzzy. Yeah, it's a bit irregular, uneven, yeah. And I agree, maybe this is a hilum. It's hard to tell without color. It could be a septation. And I hear what you're saying about some of the hyperechogenicity, the white. I see a little bit of it here. Hard to say, maybe a different view. And then if you start looking at the surrounding tissue, if we take a step back, we see some of the cobblestoning up around here, around both sides. We see a thickening of the dermal and epidermal layer. So those things taken into account. And if you look up at the CT scan, it's hard to see, but there is a dark spot in the middle, which makes me think that there is fluid in here. So this is an abscess on the lateral aspect of the neck. As we talked about, it has the irregular margins. It has some posterior acoustic enhancement, so some of those white reverberations in the back. And you're seeing the surrounding edema in the tissue. What do we think about this ultrasound? We'll say this is 6 months later. Say they come in and they have a fever, and they've been feeling kind of weak the last couple of days. Anybody have any guesses of what we might be looking at here?
On the first two, 1, 2 seconds, it's kind of normal. I think it's normal tissue. And final seconds, there are some kind of hypopercent area.
Okay.
Without any clear water. But I see some cobblestone on the spot
Okay.
area, so I think it's maybe some wood and ruptured access.
Any ruptured abscess?
Yeah.
Okay, maybe. That's a good thought. So, I agree with you. There is some, we'll look at this from the top down. I see some thickening of the epidermal layer. Unfortunately, it's very short. I agree with you that as we get towards here, we start to see some cobblestoning, but we'll talk about in a minute. I'm not quite seeing those fat lobules. To me, this fluid here looks kind of linear. And And then we talked about next is that we look to see how your fascial plane is doing. And if you think about your ultrasound, and if you're looking at, this isn't a lung, but when you look at a lung, what do we look at to see when the lung is sliding? We look at the ants on the log. So the bright white twinkling lights that help us show that air is getting there. So this is actually air running along the fascial line, so these bright white areas here, with some posterior acoustic enhancement, what is sometimes called dirty shadowing behind, because it's obscuring all of this organized tissue structure behind it. See how I agree with you over here? Normal tissue, maybe not there. And then it comes down and now we can't see those structures behind anymore. And we're seeing some layering of fluid instead of just the cobblestoning. So this is concerning for necrotizing fasciitis, where you start getting that gas inside of the tissue and especially along the fascial layer. And you'll start getting that fluid instead of giving some of that cobblestone appearance, which you see in the beginning of the clip, to seeing it start to layer out in more linear structures. But you need to be careful with this because you don't need air in the tissue to diagnose necrotizing fasciitis. It can, at the beginning, you might see just the layering of fluid. So when someone comes into you and says, my leg really hurts, and you've decided to put an ultrasound on it because the pain is kind of out of proportion to what you would expect for a cellulitis, and you see just some fluid around it, and you think, oh, this might just be edema, because I don't see any of those bright white lights indicating air. It just might mean that it's not late enough in the course for you to develop that air there. Additionally, we see some irregular borders in that fascial line. If you see at the beginning the bright white line on the right, and then it gets almost crunchy, like someone's decided to take a bite out of it. It's very irregular and wavy, which is also signifying that there's air along that fascial line, concerning for necrotizing soft tissue infection. So look at that. This is more what we talked about with that fluid stripe. In that second picture, you're starting to see some air. It's hard to tell from here if you're getting some of that posterior shadowing, but here you can see that the fluid, that hypoechoic area, the dark area, is more layering, and especially near tracking along the fascial planes, and it's not giving that cobblestone appearance of the fat lobules. It's a little bit of a deeper infection, and concerning because it's causing almost the layering, separating effect near the fascial planes. I will say, always put on color flow in case you're accidentally seeing the vessel in the long axis, and also check in the short axis, again, to make sure that you're not mistakenly seeing a vessel. Versus here, this one's a little bit more easy to see. You see the diffuse gas. So we have here and here with those bright white lights. Okay. So, in summary, your ultrasound can be pretty useful if you are at a point in your evaluation for a soft tissue infection, if this is abscess or cellulitis, to see if something is large enough to be helpful to be drained, either by your needle aspiration or with a traditional incision and drainage. I would always start, as with one of those other images, with normal tissue for comparison. So starting either proximal or distal to the area that you're concerned about, to see what those normal tissue layers look like, to see what they look like when they're organized and they're thinner. And then go systematically from top to bottom. Look at the thickness of your the epidermal and dermal layers, and then look at the subcutaneous tissue. You're looking to see for that cobblestoning or any layering of fluid, and then look at the fascial layers and look to see if you're having the layering of fluid or if you have any concerns for air with those bright white lights. And then if you have an abscess, go in the order of looking to see how your borders look. Are they regular or irregular? If you press on it, is there a central fluctuance that makes you think that there is fluid inside? Put on your color Doppler flow and make sure that there isn't any blood flow within the area and that it's outside. And then finally, you can also see if there's any air or linear fluid collections around your abscess, concerning for development into a necrotizing soft tissue infection. Okay. I know that was a lot of pictures, does